In this video, we're going to talk about PRP, or platelet-rich plasma, what it is, why it might work, what injuries PRP might be especially useful for, in this case, lateral epicondylitis, better known as tennis elbow. My name is Dr. David Geier, double board certified orthopedic surgeon, sports medicine specialist, and media medical expert. I help you feel and perform your best regardless of age, injury, or medical history. Now, please understand, in this video, I'm not giving you medical advice. This is meant for general information and educational purposes only. Now, before we start talking about PRP and how it might help for patients with tennis elbow, we have to discuss what platelet-rich plasma is. PRP is a concentration of platelets that comes from your whole blood. We put it in a centrifuge to spin it and concentrate the platelets to create a ready-to-inject product. PRP works by releasing cytokines and growth factors like platelet-derived growth factor, platelet-derived endothelial growth factor, transforming growth factor beta 1, insulin-like growth factor 1, fibroblast growth factor 2, and vascular endothelial growth factor A. Now, you probably don't care about the names of any of those, and that's fine. But what I want you to understand is these growth factors enhance healing. They stimulate cell proliferation, cell migration, cell differentiation. They modulate the immune system, they regulate inflammation, and they help with angiogenesis, the development of new blood vessels in the damaged tissue. These growth factors are essential for the three phases of healing involved in the healing of any injured tendons and ligaments, and those are inflammation, proliferation, and remodeling. In theory, PRP allows for your own blood to provide a high concentration of growth factors to promote healing in sites that have limited capacity to heal due to poor blood supply. PRP can create a matrix that serves as a scaffold for the sustained release of growth factors that can help bring in healing cells and new blood vessels to help deliver nutrients that improve healing. Now, again, specifically for tennis elbow, if we're going to talk about why PRP might be helpful for tennis elbow or lateral epicondylitis, we actually have to understand what that injury actually is. Tennis elbow is a condition causing pain on the lateral side of the elbow. Similar to medial epicondylitis or golfer's elbow, this condition develops over time, usually with no prior trauma. A small area of degeneration in one of the extensor tendons develops just off the bony prominence on the lateral side of the elbow. It causes pain on the outside of the elbow, and usually orthopedic surgeons try non-surgical treatments like a counterforce strap, activity modification, rest, physical therapy, even sometimes cortisone shots to resolve the problem without surgery. Now, let's see what the recent scientific studies tell us about how effective PRP might be for tennis elbow, for lateral epicondylitis. And again, for years, orthopedic surgeons have used cortisone shots to treat tennis elbow, but research has shown those injections can actually be detrimental to the healing of the tendon. In a systematic review of PRP versus cortisone shots, PRP provided slower relief, but provided longer lasting benefits compared to cortisone injections. Clinical improvement lasted up to 2 years for PRP, and unlike steroid shots, cortisone shots, there were no side effects with the PRP. Generally, with lateral epicondylitis, PRP is no better in the first few days or even the first few weeks after injection compared to cortisone shots. But from 6 months on, PRP is much more effective than steroids. Now, a couple of points, let's say, about the research with PRP, really for any condition. There's a lot of different methods of preparation, a lot of different final products. PRP, leukocyte-rich PRP, platelet-rich fibrin, platelet gel, and many more. They all have varying concentrations of blood cells, plasma, fibrinogen, so they have different concentrations of growth factors, different concentrations of bioactive molecules, so they might have different efficacy for tennis elbow. And the exact composition of the PRP isn't even reported in a lot of the research studies. There are leukocyte-rich PRP, white blood cell-rich PRP, leukocyte-poor PRP, plus we all have different numbers and amounts of platelets in our blood, so the different studies comparing PRP might have different results. Plus, studies differ in terms of the volume of blood harvested, whether they use anticoagulant, the number of times the blood's put in a centrifuge, the final volume of PRP, the number of platelets derived, whether the platelets are activated, and much more. All of those factors can influence the properties of the final PRP product, but also how well it works for tennis elbow. Patients often ask too, is it covered by insurance? Well, most insurance companies still consider PRP experimental and just won't cover these treatments. And again, I'm not giving you medical advice. This is meant for general information and educational purposes only. So what can we conclude about platelet-rich plasma and tennis elbow. Well, based on these recent studies, platelet-rich plasma does offer a benefit. Might not be significant early, 1 to 2 months after the injection, but it greatly exceeds the benefits over time, especially compared to cortisone shots at 3 months, 6 months, and 12 months without increased risk of adverse events like weakening the tendon or any of the other risks of steroids. It certainly appears to be a reasonable option for patients with lateral epicondylitis or tennis elbow trying to avoid surgery. If you'd like to read the studies I mentioned in this video, I've provided links in the description below. If you like videos like this one, you want more information about optimal health and wellness, healing and recovery from orthopedic injury so you can feel and perform your best regardless of age, injury, or medical history, subscribe to this channel. Click the bell to be notified of new videos and live streams. And if you have tennis elbow or some other orthopedic injury, maybe a tendon or ligament injury, and you want to see someone who truly knows about bone and joint injuries in athletes and active people, I would love to help. I'm a double board certified orthopedic surgeon and sports medicine specialist. I'd love to talk to you about all your options to recover from the injury, not just surgery, not just cortisone shots or physical therapy. Go to my website, drdavidgeier.com. Go to the contact page to make an appointment to see me. The link to my website and the contact information is in the description below. Again, my name is Dr. David Geier. Thank you so much for watching. I look forward to helping you feel and perform better than ever.